it says Bahar.
Yeah, that's fine.
Amanzadeh.
Yeah, that's fine. I will be sharing this. That's good.
Well, good afternoon, everyone. Thank you for joining the webinar. We're going to be just starting in just a moment. So thank you for your patience. Right. Okay. So it's about 12:02, so we'll go ahead and get started. So good afternoon, everyone, and thank you for joining the Community Clinical Linkages, Implementing School-Based School Link Programs and Integrating Dental Referrals webinar. My name is Keiko Miyahara from UCSF, California Oral Health Technical Assistance Center, and I'll be hosting today's presentation. So today's presentation will cover information on how to plan for school-based school link program and on the dental referral management system. We have sent out 3 documents for this webinar. In case you have not received them, we will provide the link in the chat box. Next, please. Right. So some housekeeping before we start. Everyone is muted. So if you experience any technical issues, please use the chat box to connect for help. Please use the Q&A box to ask questions during the webinar. We'll have a Q&A session towards this end of this webinar. And this presentation will be recorded and available on COTAC's website. So today we'll be hearing from 3 speakers, Dr. J. Kumar, California State's Dental Director, on building partnerships to support Community Clinical Linkages program. Our second speaker is Dr. Bahar Amanzadeh, Care Coordination and Sustainability Specialist on planning for and implementation of the school-based school link programs with the dental referral component. And our last speaker is Joanna Aalboe, Local Programs and Statewide Interventions Unit, Chief Health Program Manager of the California Department of Public Health, on alignment with the Office of Oral Health expectations and timelines. Without further ado, I would like to welcome Dr. Kumar and turn the presentation over to him. Thank you.
Thank you and good afternoon. I'm going to request control for advancing the slides. Okay. Okay. Yep, it's working. So I have 3 key messages. So I'm going to convey, I'll try to convey that in the next 10 minutes or so. I have about 10 slides. I'm going to go through those slides very quickly. So the first one is in your grant, there is an objective 6. It's about implementing evidence-based programs. And one of the key interventions we want to promote is school-based school linked programs. And the objective is to increase the number of low-income schools with a school-based school linked program. So this is going to be incorporated in the next grant cycle, and it will be the major focus of our grant. So that is number 1 key message. It's because if you think about prevention activities, there are 3 buckets. The first one is the traditional prevention that is offered in dental offices. And the number 3, the bucket 3 is community-wide prevention. So we usually talk about community water fluoridation, promoting toothbrushing, and campaigns, those kinds of activities that reach the whole population. But in the middle is this innovative clinical prevention. This is providing services outside the clinical settings, and school dental programs fit in here. And these programs have been operating for a long time. So the innovative clinical prevention practice that we are talking about there is the community clinical linkage. In other words, screening children and linking them to a source of dental care, because we think if you want to reach the whole population in California, it's very difficult to implement preventive clinical services in school settings. So and we have tremendous opportunities. So that's my second message. We can do this, and partly because of a major initiative that's going to be happening in California. The current budget, this year's budget, includes funding for public health infrastructure. The budget includes $300 million ongoing general fund beginning 22-23 for investments in public health infrastructure. And this is going to happen at the local jurisdiction level. So local health departments will be receiving funding, not necessarily for dental. So this is where you have to elevate oral health in your county's agenda and make it a high priority. So the money is not, it will not say that you have to use it for dental. So it's your responsibility to advocate for funding. If it comes through, hopefully it will happen because it's part of the next year's budget. So the funding, when we talk about public health infrastructure funding, it's for some capabilities. There are 7, these are foundational services like assessment, surveillance, policy, that is the planning, communications, partnership, and accountability and performance. So you have been already working on some of these foundational services. And the bottom half of it is about programs. So tooth decay prevention program fits nicely under chronic disease, under maternal child health, and access to and linkage clinical care. And you have the data. So we published this California Smile Survey, and you should be able to make it a strong case for investing dollars, public health, especially public health dollars, on preventing tooth decay. So I'm going to run through some of the slides. So the number one thing is, tooth decay remains a public health problem, and and we have profound disparities when it comes to geography, when it comes to ethnicity and race, when it comes to income, education, language, and we published this report in the California Dental Journal. So, and we can make improvement. So it's seen from the last survey to this survey, we have seen improvement when it comes to tooth decay prevalence, untreated decay, and increasing sealant. So in other words, we know how to improve and how to address tooth decay disparities. So this is, so if you look at data, the prevalence in tooth decay mirrors community conditions. So Central Valley has the highest prevalence of tooth decay. And if you look at the other map, the healthy place map, you'll see the community conditions are least healthy in many of these counties. So we have a framework, and we have a goal, we have a framework, we have very effective interventions to bring about changes. And community clinical linkage is one of the elements in our framework, and it aligns nicely with the kindergarten oral health assessment as well as with the dental visit. And it is also supported by the CalAIM initiative. So this is the new medical initiative which builds on dental transformation initiative that occurred between 2015 and 20. So it's going to be implemented January 22, and there are 2 components here. One is the caries risk assessment bundle for young children, 0 to 6-year-old. It consists of all the effective interventions plus silver diamine, fluoride, and nutritional counseling, and pay for performance for 2 adult and 17 children preventive services codes. And it also includes continuity, pay for performance for continuity of care. In other words, there are incentives. So if you identify a child in kindergarten and link that child to a dental setting, there are incentives for dental offices to keep the child and offer preventive services. So because of those things, and one other improvement that is going to be occurring in the medical dental not medical dental, in the medical program, is the fluoride varnish application and other preventive services. So this is part of the preventive services report, which is going to be monitored as part of the managed care quality and monitoring division activities. And you have a map here. It shows that the fluoride varnish application in primary care providers' offices is very low. It's only about 3%. 3% of members receive treatment from non-dental providers. So we want to make a big difference in the next 5 years with respect to this indicator. So that will require you to work with managed care plans and primary care providers. So this is the number. So using a CDC criteria, that is all public elementary urban schools with greater than 50% of students on free and reduced lunch program, and all rural schools eligible for school-based school linked program. So we came up with this number, 4,626 schools. So the key message is we want to expand the program to reach all 4,626 schools. That means you have to have a plan in place. So the plan should not be based just on a small number of children, because you won't be able to move the needle. It should be a comprehensive. How are you going to reach all these targeted schools? So you have some funding, you may need more funding. So you have to have plan with different options. If you want to provide school-based, school-linked, you want to target one grade versus all grades. So you have to plan with several options in place and elevate oral health in your county's agenda. So, you should be able to achieve this target by the end of next 5-year grant cycle. So that's our vision for local oral health programs. So with that, I am going to stop here. I don't know whether I have time to take a few questions here. Dr. Amanzadeh.
Hello, Dr. Kumar. Yes.
I want to give up remote control.
Yes.
So you will have access to it.
Thank you so much. Yes. If there are not any pressing questions, we will keep them for the end, if that's okay.
Okay.
That's okay? Okay, great.
Thank you.
Thank you so much, Dr. Kumar. Really appreciate your vision and just leading us in these efforts. Hello, everyone. I'm Bahar Amanzadeh. Very happy to be here. And after Dr. Kumar shared the vision for this, now I want to bring it down to, okay, how do we plan and how do we think about implementation of a school-based link programs with a dental referral component? Make sure I have control. Yes, I do. Okay. So how do we go about planning? We want to make it happen. As Dr. Kumar mentioned, we want to move the needle. We want to make sure that we reach out to as many schools that are eligible in our counties, and we want to have programs that are sustainable and are, and are kind of like based on actual evidence-based or promising practices. So it's amazing, sounds great, but how do we get there, right? So here is like a roadmap that we have created together to kind of like walk you through this planning phase. 9 steps that I'm going to talk about them one at a time. First would be analyzing the needs and challenges and strength and kind of figuring out where you are. Then identifying the model of the school-based or school-linked program. Then how to engage dental providers. And number 4 would be plan for dental referral management system, which we'll talk a little more about that. Aligning with care coordination models, developing a rollout plan, developing a logic model, planning for sustainability, and developing performance measures and quality improvement approaches. So first, analyzing the needs, challenges, and strengths. Why we do that is because there's a lot of infrastructure building and a lot of programs, a lot of partnership that has been building at the local oral health programs during the last 5 years, and for some even longer than that. Looking at where you are, what you have built, and from there building on that for the next steps, especially with this new kind of focus on more of like an intervention base, is really important. And I say that because many of you might have been focusing more on building, let's say, oral health literacy and having campaigns around oral health education, building partnerships, but you may not have necessarily been in schools or have done interventions. So, so this could be a new kind of a little bit of shift of how you see yourself, how your partners see yourself. So in order to kind of really build on that, it's good to do a little bit of analyzing of, okay, where are we, what we have gained, what are some challenges moving forward, what are some needs, and from there kind of building your next steps. Doing a SWOT analysis sometimes helps, and you could do a SWOT in general and see where your program is, and then put the lens of a school-based, a school-linked program, and the referral management system as part of that, and then kind of continue your SWOT so that you can see where you are and what are some, basically where are your readiness, what are some needs, so that you can basically build on those. Second step would be to identify your model of a school-based, a school-linked program. And what I mean by that, basically model, and from there the extent and the details of it, is different counties are in different places as far as what kind of programs are already functioning in the county. There might be counties that they have FQHCs and school-based programs, or they have other programs, more commercial programs. In the programs, bringing a school-linked programs or some school-based programs. And there might be some that have already had communications with the schools, but haven't really gone further than a screening. So there's some that have had active COHA, and that has established some communication with the schools. So by doing an environmental scan and seeing who is doing what at which schools, and also looking at identifying the schools that are eligible in your county. As Dr. Kumar was saying, the kind of the formula of looking at the free and reduced meal program, looking at that and saying, who are the eligible schools? What are some programs already going on? What are our partnerships with the school like, right? Other superintendents that we have had communications, and there's some that we need to build more of communication with, right? The same with the school nurses. So building on that, kind of developing some like partnership and building on what you have on the ground. And from there, identifying your model. Because before that, if you don't look at that, it's hard to say that, do you want to do a school-based or school-linked programs, right? Or a combination of that, depend on different schools, right? So, and I know we have talked about that, but I'm just going to define a school-based versus a school-linked just for a second. So a school-linked is when you go provide a screening, and then you link, based on the level of urgency, you link this, the kids to the source of receiving services, right? A school-based is that you bring some sort of services to the school in addition to that. And that could be the school student program, or it could be further than that, like bringing more services to the school. And you know, depending on which one you go, then you will need to also know, you know, what kind of equipment do you need and what kind of existing infrastructure you need to do that. So we're going to talk a little more about that. But one of the things that is important is that this is a gradual planning. So as you're hearing this presentation and as we're going through these steps, this is to give you the big picture, but we also don't want you to feel like this is going to happen over a month, right? You are going to think about the gradual planning around this, right? So when you look at the existing providers and you start talking, then you will see where is the momentum, where is the low-hanging fruit to get it started, and then kind of build on that and move that forward. This is another part of this. As you plan this program also in the schools, design also an early prevention program that goes with it. We all know that referral to care is great, but, and our hope is that a lot of those kids that we touch establish dental home, but also the capacity to do care coordination or referral is limited at the beginning. So you may not be able to care coordinate all of your kids to the source of having a dental home. So when you are in the community, what is your early prevention program that you also bring to the schools, right? How are you improving the oral health of the children when you are having that point of service, when you are at the schools, right? And when we talk about logic model, that kind of goes along with that, right? What are you doing? Apologies. What are you doing in the field? And then what are you referring out? I think it's the air quality. And then another part is also planning the staffing, right? So when you are in the schools and when you're thinking about who is gonna be in the schools, other volunteers or providers in the community, are those private or community clinics or commercial dental providers who are gonna work with us? So basically building the partnership, but also the staffing of your program based on that, right? And then from there, then you can plan for and purchase equipment needed. You can look into if you're having a school-linked program, you probably need less equipments. If you're having a school-based program, you probably need more. And you can kind of have those conversations with the partners that you have identified and plan for the equipments based on that. And all of that comes down to thinking through the cost and billing and sustainability as well, right? For example, if you are bringing a volunteer provider, that brings your cost on. However, is that sustainable, right? If you're bringing providers that you pay them honorarium, how is that going to work long term, right? If you're bringing FQHCs, what are the implications of that? So when we get to provider piece, we're going to talk a little more of that. And so here is a good segue to talk about the dental providers. So the same here, you do an environmental scan to see who are the existing providers in a school and how you can establish alignments. One thing that I want to say is that, again, sometimes you have FQHCs that are very active, sometimes they're private providers. One way to also think about it is that as you start putting the word out, you will get the engagement of the providers at a different level. There was a story that a few days ago, I received an email in one of the counties that I work closely with, that a provider who is part of an FQHC, and we have had conversations about the FQHC working with us, just reached out to us and said, you know what, I actually want to reduce my time in FQHC and become a private provider, a fee for service, because I feel there is some, this is a long-term, this is sustainable, and I can help different counties in providing a school-based programs. And I say this is a story because to me, this was amazing that how when you put the word out there and you start building partnerships, you also start creating some shifts in your community and even in your providers pools. And as always, really think about this in an innovative way. When you're thinking about sustaining the efforts, when it comes about engaging RDHAPs, and again, all of the other kind of providers, what are some innovative ways to bring them to the program and also sustain their efforts? At some point in the next webinars, we're going to talk more about the sustainability aspect, which, as you know, it's different for fee-for-service and FQHCs. But FQHCs, if they bring the services and establish extramural sites, then that's sustainable for them, but that takes longer. And for fee-for-service dental providers, under these grants, you could pay them honorarium as part of the budget that, and I have confirmed that with Office of Oral Health. And you need to go through the process of getting the budget approval, but that could be a way to really thinking about some sustainability, because really the volunteer pool works to begin with, but it may not be a way to count on the long term. So that's something you can think about as well. And as always, like increasing the pool of providers that accept medical in your county, and what are some of the long-term approaches that you have around that? Okay. I know we're sharing a lot of information here, but I really appreciate your attention. And now we are at the exciting subject of dental referral management system. And we're gonna have a section at the end to really focus on that. When you're thinking about having this component, having the component of a referral management system, and that which is electronic and builds that infrastructure in the county, I would like to encourage you to think of it as an infrastructure that is going to help you do the rest of the work, right? So we have had some focus on it before, and the reason to have focus is to plan for it in a right way. But really, the way that this would be successful if this is embedded in the rest of your program planning, right? And by that, again, this is all of these steps that we have been talking about. Some of the areas specific to planning for the dental referral management system and its implementation is identifying who is going to use it, what setting it's going to be used, right? Identifying capacity that you have to work at the schools and community level. Because you have a system, but with the system comes, okay, who is going to actually do the referral? What is the extent of our referral, right? And we're going to talk about the care coordination models in the county just in a little bit, but these are the parts that come into thinking through the utilizing this referral management system very efficiently. Also, identifying settings and organizations that are interested to be involved. And when we talk about that, again, with having your advisory committees or other work groups that you have at the county level, these are really the think tanks for you right now to bring these conversations and see what's the level of engagement and who wants to play, right? And from there, you can see what are the immediate partnerships that you can count on, and what are some long-term partnerships that you want to build around that, right? Okay, I was hoping this is the next one. This one is, when we talk about any referral management system, again, it's not going to work in silo, right? You want to think about what are some care coordination models, who are the partners who are doing the care coordination in the county that you can partner with. If your MCAH program or if your CHGP program is involved in dental care coordination and has the capacity to partner with, right? Working with them and saying, what would that partnership look like? If there are some other partners, community-based organizations that have community health workers model, right? And they have been utilizing that successfully. Having those conversations saying, what are the ways that you can collaborate, making sure that the dental care coordination gets its own attention, right? Within the kind of like these alignments of the efforts that you do together. Some other partners that you could look into are family resource centers, First 5, WIC centers, and just really see what are some ways that this partnership can happen. Another important aspect as you look into the care coordination models in your county is that when I mentioned that, but when you're aligning efforts in care coordination, if that's the way you want to go, right, then kind of like think about, again, who is doing what, who is doing care coordination, and if they're willing to add dental, what kind of training do they need, right? Or if you are establishing that within your own program, what are some needs that you have around that, right? To kind of strengthen that. And step 6, with all of these in mind, and when you have done your homework, have gone through kind of thinking through all of that, then you are ready to develop a roll-up plan. And with that, what we mean is that, again, you have an initial plan. You go with what is easy, right? What is promising and is easy. What partners do you have on the ground? What you have established? And in looking at your SWOT analysis, what are some strengths that you can count on, right? And what is your plan for expansion? And you want to set that up from the beginning. You want to set yourself up for long-term success from the beginning, right? Saying, here's where I start, and here we're planning to go. One thing that happens, and you have probably, a lot of you have seen in public health, is that we are good at piloting, but we are not necessarily good at expanding and changing the needle. And what we really here want is pilots, however, think about expansion. Think about how are we changing the oral health of the children who we are touching, right? And we want to kind of have a county-wide impact. So identifying those incremental 5-year goals are really important. And with that, then thinking about your logic model. And thinking about the logic model is really kind of putting this together. It's like, okay, I have these partners, I have these programs, here's how I'm planning to make an impact. Here are the areas that we're planning to change, right? Developing smart objectives that are specific, measurable, achievable, realistic, and time-bound is really important. And you know, the assessment, and this is this picture that you see is from Clock Foundation, and they have a good toolkit around logic model development. And we are going to incorporate some of these tools and other resources into COTAC, so you have some tools to look at. But really make your logic model an implementable logic model, right? That gives you a long-term thinking, but at the same time, give you points of thinking through what else do we need to incorporate into that. Another important aspect of developing a logic model is that, as Dr. Kumar mentioned, there will be opportunities for funding that are coming our way. And if we have developed all of these and you have a logic model, then you can go in with that and you can kind of like really put that forward and kind of like get the funding that you need to develop the rest of your program. And plan for sustainability. This is probably one of the most important parts of really making this long-term. Looking into interdepartmental, local, and statewide resources, right? Also gathering data for kind of being ready for funding opportunities. Another thing that is not written here, but it's like part of that, is sustainability of your program in terms of the sustainability of the efforts, right? So if you are building relationships with some organizations, what organizations are they? How sustainable those partnerships are? Are they accountable? Can both of, or do you come accountable when you're working with your partners, right? Can they count on you? So I think those elements of sustainability that are beyond the money part of it sometimes are overlooked, but they're nevertheless very important to really build sustainable partnership and sustainable programs. And step 9 is developing the performance measures and your quality improvement approaches. Again, when you start at the beginning, you may not have all of the answers. You have some ideas that what are some performance measures and how you are going to look at your quality improvement. What are you checking? When you are having a school-based program, what are the things that you want to know that are in place? Is it the quality of the referral? Is it if you're having a CLM programs, the quality of CLMs? Is it that, what is the number of the things that were put in place? And as you move forward, how do you build on them? Is it the partnerships that are sustained, right? And if you need to kind of go back and check and make changes, where do you go and how do you check for that? As part of this webinar, we have developed few tools that are going to help you in this planning. They're really parallel to the Apologies. They're parallel to the areas that we discussed here, but they're really kind of designed to help you go through this thinking process. I know Kiko has put them in the chat box, and please let us know with any questions. One of them is Excel sheet for this from now till the June of 2022 to help you through this planning process, right? And kind of like really go through, identify your model, you know, did we do the SWOT? What are the dental providers? How are we going to go with that, right? And kind of like using that again as a thinking tool for you. Take a look at that and let us know with any questions around that. This one is a flow chart that kind of like puts all of that in perspective. It's really visual, the same thing, but kind of like a summarized version of it. And the way I would suggest that you use these tools is they're not necessarily linear, right? So you may start looking at your needs, challenges, and strengths, and then from there, develop a draft of your logic model of what are the things that that you have in place, right? And then go back and kind of think about your school-based programs, think about the providers that could do that, right? And then kind of like from there, see who are the providers, how do we engage those, right? And when you kind of like go through all of that, again, you kind of go back and forth to kind of making sure these steps really inform each other. One area about the providers that in this visual, it kind of helps to say it that way, is that when you're thinking about providers, you're thinking about providers who will participate in your school-based schooling program, right, to bring those services or the screening aspect of it to the schools. And you're thinking about the providers who will accept the referral from your program, right? Again, think of it as like you're having this comprehensive program that has a referral component to that, right? So when you're starting engaging the providers, you're basically working on two different aspects of engagement of the providers. So keep that in your mind as you go through this planning process. And we talked about that, but just reiterating that one more time. Again, these steps can be repeated to inform each other, right? For example, you think about, okay, we have that FQHC that is working in that school district. They're willing to play with us, right? We want to bring them on. However, we have this other district that has schools that they have more needs, but we don't have any providers there, right? Where do we start? This area with the higher percentage of schools that are eligible has more needs, but we don't have any provider right there. And then how do we plan for that, right? And kind of like, again, kind of bringing sustainability and logic model into that to inform your processes. And that will inform your model, your partners, and the anticipated number for each year, right? Like, what is the goal? What are you trying to achieve? We're going to talk about that in a second. All right, so you went through the planning, right? Amazing job. June comes in, you have had an amazing kind of planning process in place. You have planned and you have started maybe even piloting, and you want to have some implementation metrics for your work. You want to have the number of the schools participating. You want to gather the grades in each school, right? Number of students that you intend to reach, providers who perform screenings, users of the referral system, care coordinators, or people who do the referrals, providers who accept the referral, services that you bring, right? Either it's a screening, white varnish application, sealant, or further, and the early prevention program that goes with that, right? So basically, after you go through this, then you start coming up with some projected numbers that you want to work towards, right? You project the numbers, again, specifically because without that, you will stay in the piloting phase for too long. And just knowing that in public health, without aiming for the next step, right, we might become stagnant. So that is really important for you. And this would be part of the communication with the state as you move forward. This is another resource that you have received, and it's going to be in the chat box as well. This is more of like the implementation plan grid, right? Here's as we talked. And it has different pages. Hey, year one, here are the number of the schools, the grades, providers, right? All of those areas. Who is responsible, what's your status, right? As you move through different quarters, you kind of like look at your progress, right? And you kind of like have a way of doing the quality improvement approach. It's like, if you're not making enough progress, what can you do to change that? Okay, fantastic. So we talked about the planning and implementation. I know we're going to talk more about that as we move forward, but now I want to take a little time and have a little focus on the dental referral management system. You have heard from us and from Office of Oral Health that the dental referral management system is coming your way. You have listened to some webinars around from different companies, and each of them have had their own strengths and things that they could improve on. So just we wanted to kind of like bring some clarification on next steps around that. So first of all, I wanted to thank you all to filling out the survey that you sent you around that, and amazing feedback. All of you, about 56 entities filled it out, great feedback. And in our next webinar, we're going to go into detail of some of those questions, some of the concerns and challenges around that. Today, we're going to focus a little bit on that and bring some clarification around that. So one of the most important things that we heard that at the local level folks would need is a training on care coordination. And I think it's important to really clarify that. And when we have a dental referral management system, at the beginning, it might be more of a referral. And as you build your program and as you build more of like the staffing to do that, then you're hoping there will be ways to kind of close the loop of the referral and do more of what we call care coordination, right? So, and, you know, I mean, this is the number one need that's, and that people express, that we want to make sure there are trainings on that, right? The number two was, you know, we will need help in planning a rollout of the program, right? Number three was we need help in establishing partnership with dental providers, and how do we go about that? And number four was establishing partnership with the schools. Many also said that that would be an area that they could use some guidance and technical assistance. So good news is that we're here to provide that. We will definitely bring on some trainings, and we'll kind of here to bring also, we're going to have ongoing webinars as well as technical assistance to help you with all of this. Some logistical clarification about the referral management system is that Office of Oral Health has been working to choose a unified system that would operate at the state level. And that might be a new information for some of you, because at the beginning, the conversation was that you would choose your referral management system and you get funding to do that. However, by doing that, by having a system that is being run at the state level, this really brings the infrastructure and continuity that all of us need at the state level. There will be room for each county to make their own specifications. So, you know, the minimum and the kind of most important pieces will be there, and you will have that freedom and that autonomy to add to that and make that kind of that local level kind of customization, basically, right, to some level. Also, you will have the freedom to choose another system if you think that that state level system is not working with you, especially if you have been working with one. If you have, for example, if you have had a local dental pilot project and you have used the system, that then your partners are kind of familiar with that and it has worked for you, then you know, then that really makes sense, right, to move forward with that. So I think that the beauty of this kind of planning is that, again, you don't have, for some of the counties who haven't had that experience of kind of figuring out what are some elements of a system that would work and what they need as far as a specification, there would be a unified system that kind of brings us all on board, right? And then for those who want to kind of add extra, you can get that as well. For me, this is exciting because, you know, working in public health, you always like work on pilots, you try to develop things, and you always hope that at some point, some infrastructure building will happen at a bigger level, at a state level or national level, right? And I feel like this is one of those opportunities that we have had. And it's really important to kind of look at it in that view and see, okay, with that infrastructure, how can we still kind of customize that to the needs of the communities that we're working with? Another clarification around that is that the specifications that are being used to inform the development of the system it's really being informed by the feedback that you get from you at the local oral health programs, and also pilots such as local dental pilot projects. So, you know, we continue to get that feedback, and we hope that we can really kind of enrich the specification and enrich the ways of launching that program and the system at the local level. Also, another important aspect of it is that it needs to be HIPAA compliant. So yes, it is HIPAA compliant. There will be trainings on that as part of the launching of the system, and kind of like trainings on if there needs to be MOUs and all of that, what they would be like, and it can be used in different settings. So this is part of a planning, something at that level that actually simplifies the process when it's at the state level, simplifies the process of its usage at the county level. Again, counties have the freedom to choose another one if they think another one will best fit their needs, but then they have to make sure that the metrics that we're going to use is going to be replicated in the other system. There's going to be more information coming from the Office of Oral Health to clarify the budget for those of you who applied for the RFA. You know, if there were budget items that show that you will pay for your system, and now that the state is going to pay for that, then there's going to be some budgetary freedom basically to be used in other areas. And Office of Oral Health will bring some clarification on that very soon. There will be trainings and support as part of launching the system. And you know, the integration of the system with the other system, that would be part of the future plans. I'm hearing some background noise. If you could please make sure that, Nancy, could please make sure that others are muted. I would really appreciate that. So really, the kind of thinking, I know there were some questions as far as, you know, would this system work with the, you know, electronic record system that we had at the dental offices? Would it work with the primary care offices? And that's where we would hope we will get at one day, but probably it's not going to happen at the beginning. It would be part of the future plans. Like everything, we're also kind of rolling this out too. So we want to make sure we have realistic ways of rollouts and then build on our success as we pilot. The timeline for that, you know, given that now it's going to be really be built at the state level, probably 2022 is more realistic to just think about the state procurement, just make sure that it goes through the state processes and the kind of you know, contracts are in place and all of the trainings are in place. This doesn't mean that you have to wait till then to start your planning or start thinking about what you need to have at the local level. One of the things that I have heard some of the some of the partners at the local level have mentioned is that there are some level of referral happening, at least as part of COHA, for example, right? And many of them are paper-based. Many of the screening are paper-based, right? And some are excited that, you know, there is this system that now will take on and kind of like move that, you know, be able to kind of like basically have everything electronically as a system. But there are also some concerns about in rural areas that they may not have the infrastructure to go mobile or to go web-based all of a sudden, right? So, you know, one ways of like thinking about the piloting the program is that could you start having all of the components without having the electronic referral, but having the components of how it would work, so that when you have the system itself, that would be really kind of like an easy to launch in place, right? And be integrated into your existing program. So these are some ways that you can start thinking about that, right? As you think about this, these timelines and how it works. One other thing that I wanted to mention here is that, you know, we talked about kind of partnership and who you are working with and how it works. One partnership that you really want to also explore is the partnership with your IT department inside your department. And what are some, you know, or also the same thing like the web availability with your partners within your community systems, right, within your schools, and what are they like? So that could be part of your SWOT analysis, right? What do we have? What do we do not have? And, you know, where can we go with it, right? You know, is it that we are going to go paper-based and then as, you know, and then we just transfer this information into our website, you know, into our system another time, right? So kind of like having those thoughts about what is the implementability of the program on the ground. So thinking about next steps is more webinars are being planned, right? So we will be sharing guidance with you. We'll be exploring promising practicing at the local level. We're hoping to bring some of you at the local level who have had experience at different levels of it so that you can share with your colleagues what you have done and how you're going through this. We will probably have webinar every month or every month or two for the next few months to kind of like really help us in the planning phase. And make sure that you reach out to us as we go through planning, so that, you know, I personally am here to bring technical assistance. So make sure you individually reach out to me around this, and that would be my focus. And I would be happy to kind of like think with you through these planning phases. So now with this, we wanna have a poll and think about our next webinar. In our next webinar, we're gonna delve deeper. It's gonna be part 2 of this same webinar, but we're going to have a little more focus on the dental referral management system as well. So Nancy, if I could please ask you to share the poll with all of our attendees. Fantastic.
I'm going to leave it out for about 30 seconds to make sure that everybody.
Yes, thank you. So these are Tuesdays in September from 12 to 1:30. And please choose all that apply. You may want to extend the time, Nancy, to get more participation.
Okay, we got the results.
Maybe just let's wait just a little more. I'm seeing people are still adding. Or maybe we're good now. Okay, thank you.
Yeah, 94% participated already. Okay.
Okay.
All right.
Okay, fantastic. So with this, seems like September 28th might has,
Mm-hmm.
you know, the longest. So we will look into these results, and we will let you know when would be the next webinar. And thank you so much for doing that. Great. Fantastic. So with that, and if you please mute yourself just to reduce the background noise. Thank you. So with that, I would like to pass it on to Joanna. Joanna Aalboe from Office of Oral Health. You all know Joanna, and she's gonna talk about Office of Oral Health perspective around that. Joanna, we are ready for you.
All right, great. Good afternoon, everybody.
Share
Thank you,
your
Dr.
video as well.
Amanzadeh.
You're welcome.
It says my video, you cannot start your video because the host has stopped it.
Oh. Nancy, if you would please look at that. And if not, we're happy that you're talking. Apologies for that, I'm sure.
Okay.
Yes.
I checked it one more time. It's saying the same thing, but okay, I can get started and we'll see if it'll work in just a moment. So good afternoon, everybody. It's so great to see all the participation, having you all here today. Really appreciate you taking the time to come and listen and participate. So thank you, Dr. Amanzadeh, for all the information you shared. And I was just going to take a minute to discuss the planning timeline and offer a few suggestions. So next slide, please. The Office of Oral Health would like to encourage everyone to begin planning school dental programs now. I know COVID caused delays. We lost a little bit of time, but now is a good time to continue from where you left off and capitalize on what you have established. So thank you again to Dr. Amanzadeh. She created this excellent step-by-step planning process, as well as the planning tools like the planning grid and the flow chart to help you. Again, the links, Keiko put the links in the chat. So thank you for all of those planning tools. The Office of Oral Health would also like to see this focus on planning for the next fiscal year with the selection of schools, children, providers, as well as your school dental program model. So the school-based or the school-linked. And we'd like to see this by December or early January in preparation for the implementation. So the Office of Oral Health would like you to aim for piloting at least one school dental program by January of 2022. Next slide, please. For the timeline. Yeah, thank you. So with that being said, use this as a guide. Here's a sample timeline. It's difficult because each LOHP is very different and in a very different place. So many of you are well ahead and ready to pilot in January. For some of you, it might take a little bit longer, but we'd like to encourage you to work through each step and set yourself up for success. And I just want you to know that we are here to help you. And like Dr. Amanzadeh said, these aren't really linear. You may go back to a step to improve some of the planning or adding to something that you've done so far. Again, the steps could inform one another, but this was just a sample of starting to begin working through the steps. Some things we would like to see happen by January, some things by February, and then we're hoping things will fall into place. So we feel pretty fortunate that we have this whole year as a planning year, a chance to make up for some of the time that we lost with COVID. And we're excited. We're excited to see what's coming for the next cycle. So I want to thank you all again. And next slide, please. Yeah, so now it looks like we are ready to open up for questions. And like Dr. Amanzadeh said, it was a lot of information. There's a lot of details that we still need to share. But we're happy to talk through that and look at the steps that Dr. Amanzadeh outlined. I think I'll turn it over to Keiko. I think she was going to monitor the questions for us.
Great, thank you, Joanna. So we will be starting the questions and answers session now. So I would like to invite all the speakers back on video, please. Great, so we have Dr. Amanzadeh, Dr. Kumar, and
I apologize. Mine still says you cannot start your video because the host has stopped it.
oh,
There's an
all right.
okay. Sorry about that.
That's okay. I know you're there, Joanna. Well, thank you. Yeah, so I'm going to go ahead and start with the first question. And this is coming from Jan Resler in Sacramento. She's asking about whether there is going to be an opportunity to advocate for inclusions of dental care coordination in CalAIM.
You can always advocate.
All right. All right. And our next question is from Kismadeep of Imperial County. So she's asking, does target children refer to the total number of children who were screened, or the total number of children who were brought back permission slips, or if it's the total number in the school when looking at the sealant and fluoride programs, or percentages, excuse me?
So our goal is to increase the number of children in these targeted schools. So that should be the bottom line.
Great, thank you, Dr. Kumar. And the next question, I think, Dr. Kumar, you might have touched on this, but this is coming from Aya from Shasta County. She's asking, what are the deciding factors for choosing one model over the other, school-based or school-linked?
Great question. So I listed 3-4 things there. So if you look at, your capacity, your resources, and your community support, because you have to have the support from the schools. So those are, some of the considerations in deciding whether you want to choose a school-linked program or a school-based program.
I may add to that. I also think when you think about the way that you want to make the change, really kind of like in your community, if you could, if you could bring enough providers to see the dental providers, right? If you have enough providers in the community, then a school-linked program will really help you to establish that dental home. If not, and then if you have more opportunities to bring, let's say, a sealant program to the schools and kind of brings some preventive services to the school, then you overcome some of the access to care barriers that way. So again, just expansion of what Dr. Kumar was saying.
Right, thank you both. So next question, it's coming from Robin Cox and Cherie. They're asking, can LOHP funds be used for honoraria, say for screenings? And who receives the honorarium and for what tax? And what is the approved amount?
I think Joanna is the person who has the answer to this question.
Okay, thanks, Dr. Kumar. Yes, we can allow for honorariums or stipends for licensed dental providers to provide screenings for children. And the reason is because screenings aren't reimbursable. So we do have to be careful about, I know some of the events, they were doing a combination of like screening and fluoride. So just remember, fluoride varnishes are billable to Medicaid. So we don't want to pay for a provider for services that they can get reimbursed for. But because the screenings aren't reimbursable, and we understand that it's hard to ask for volunteers, we can do an honorarium or a stipend. And what we'll ask you to do is turn in the proposal to the Office of Oral Health, your program consultant. We want to list how many events, how many providers, at what cost are you going to, what the honorarium cost is, and how many kids you're going to see. So we want to make sure that it's also impactful. So for instance, San Francisco County was able to screen all of the kindergartners in San Francisco County, and Humboldt has a plan right now they're going to be able to screen all kindergartners in Humboldt. So we want to make sure that it's impactful. And then we'll work through the details with you. But yes, we can provide that honorarium for what we would call, volunteer licensed dental professionals in your area to provide screenings, dental screenings, especially for the COA.
Great, thank you. So next question, it's similar questions coming from Cherie and also Rhoda Gonzalez. I'll start with a statement. So they're saying that COVID's impact on academic benchmarks. Schools are not willing to sacrifice class time for academics for oral health. And the question is, it's multi-part. Would it be possible for the Office of Oral Health and the CDE to send school districts and county office joint letters encouraging schools to allow local oral health programs into schools? And the next question is, would it be possible for Office of Oral Health and CDE to offer incentives for school districts to work with local oral health programs? Any suggestions to help local oral health programs overcome this challenge?
So I'll take that question. So the first one, yes, we can work with the Department of Education, send out a letter encouraging, but you should know that the decisions are made at the local level. So unless you advocate at the local level, it's not going to happen. So the second one is incentives. I don't think any amount of incentive will encourage a school to bring, unless it's in millions of dollars. Right now, schools are getting, enormous amount of funding. So whatever we come up with, it will be minimal. So it will not be, I don't think incentives will work.
Great. Thank you, Dr. Kumar. So the next question is coming from Laura from Humboldt. So for children identified through COA with urgent or emergency care, what guidance do you have about who should be the lead to ensure these child receives care? Would it be the public health care coordination or the school, such as school nurses or social workers, assuming that there is an MOU in place?
Would you clarify who would be providing the care? Sorry, I didn't.
Yeah, who will be the lead in providing the care coordination?
Care
Would it be?
So, I wanted to start answering this question. Bahar, you worked in a local health department, so you may be in a much better position to answer this one. So when I came here, people told me, don't tell anything to local health departments about solutions. They know the problem and they know the answer. So I don't want to give you the answer. So Laura, I think you should be able to come up with an answer that suits your jurisdiction, because in California, every county is different. The circumstances, resources, capacities are all different. So you are in the best position to come up with the solution. And we don't want to dictate a solution.
Yeah, I agree. It's, when it comes to kind of providing care coordination or doing the referral, right, at least at the beginning, right, it's one of those services that it's very much needed. We all know that it's at the community level, it works. It's resource intensive. So those who have had LDPPs, they know that it takes a lot of resources to actually have like somebody be an actual care coordinator or case manager. So if you are having this program, again, thinking about the resources and the model and thinking, is there ways to work with groups who already have this model, have a kind of care coordinators, and how can we integrate with them? That's probably one of the places that you could start with. You can also build your internal staffing, if there's room in the budget as more clarifications come from Office of Oral Health, you could look into that. I know in the survey that we did, a lot of folks said that in the next webinar, we're going to talk about that. A lot of folks mentioned that they think that their local staff at the LOHP level will be most likely, I think 46% said that would be most likely be the one doing that. Interestingly enough, only 6% thought that CHDP would be doing that. So again, kind of a little bit of reality check, right? Because on paper, we'll think, oh, CHDP would be part of that. But it seems like in reality, a lot of you think that your own staff probably will be more appropriate to do that.
Thank you, Dr. Kumar and Dr. Amanzadeh. So next question also is coming from Laura. She's asking, what do local oral health programs do when the demand for dental care is much greater than the capacity for the limited dental professionals to provide service?
Great question. The simple answer is reduce the demand, increase the capacity. But I know it's very, very difficult to do, Laura. So I can think of, in order to, the first thing I would do is reach out to the dental association, dental society, all the dentists to find, and dental hygienists to see what, whether they can take referral from school dental programs or not. So we, you can estimate if you screen one grade, what proportion of children roughly will be in the 3 buckets, that is emergency, urgent, needing some care in the next 6 months. And based on that, you can communicate to them, I have 100 children, emergency children, can each of you take 2 or 3 or 10, depending on the capacity. So that's one approach. The second one is you can increase the capacity. So there are a couple of ways to do it. One is, California has this very attractive loan repayment practice support. So you can start recruiting dentists to come to your county. So that you can reach out to this California Dental Association, CDA presents, you can reach out to the California Dental Hygienists Association and see if there is a way you can market Humboldt County for dentists and dental hygienists to come and look at the practices. So there, and then of course, bring attention to this problem. So if you can put together a report about the demand and the lack of capacity, you can go to your county and advocate for funds. And another way to do it is to get a lot of media attention and reach out to the television, radio, and all these stations and start talking about the extent of the problem in the county. So other dentists may learn about it and decide to set up a practice in Humboldt County. So, and we're also exploring ways to bring in, to create a consortium of dental schools and see if we can create externship opportunities for students to work in some of these rural counties. I learned that, for example, UCSF has a program that rotates students through Shasta County. And so there may be opportunities to create capacity in your county to bring a similar kind of program. And the hope is that some of these students will start liking your county and use the loan repayment dollars to set up their own practice in your county. So, so the number one is to reduce the demand. And one other thing I forgot, if everybody brushed and if everybody stopped drinking sugar sweetened beverages, there won't be this huge problem of cavities. So these are all, if they improve home care, then that will reduce the demand for dental care.
Dr. Kumar, I just wanted to add to what you were saying that I think any change to the provider capacity is a long-term goal. It's, I know there are things happening at the state level, things happening at the local level. And as we are, just reiterating what Dr. Kumar was saying, as we are kind of working on this school-based schooling program and talking to providers, I mean, that example I was just sharing with you during the presentation, that's like a demand kind of created the solution, right? The providers are like, I'm just gonna quit half of my FQC time and start my own practice so that I can provide the school-based programs at least, right? Again, it's not a simple answer, it's not a magic, but it takes all of us to acknowledge it as an issue and kind of having both local and the higher level solutions. So this is something that I think we should kind of continue having conversations around it. And one thing that I have observed at the local level is that not all of the local oral health programs see that in their role to have those kind of conversations or impacts. I have seen a lot of LOHPs that kind of, they're a little shy to approach FQHCs or providers in that capacity and that high level kind of conversations was like, how can we improve the capacity? How can we work with the dental society, right? So I feel like this is kind of like a little bit of like also having a little niche, a little role identification in the LOHPs to start having those kind of conversations.
So Bahar, you know, one thing, we never defined school-based and school-linked services. Would you mind describing in a little bit detail what it takes to, what is a school-based and what a school-based program, what it takes to set up one?
Sure, yes. So I'll tell you what I think and please correct me. So a school-linked programs is when basically the main goal of being in a school is to provide a screening and identify the need and then link the kids to the source of care, right? And then there's some preventive programs that could come with it, but the main focus of the program is that linkage. A school-based programs, you bring, and you know, if you have a school-based program, you do not even need a dental chair. You could do the screening on a regular chairs. You know, if you add the fluoride varnish component to that, you know, that's something that you may need. But you could go passive consent so that you don't need the fluoride varnish. You can get a higher rate of like people accepting that and just like do it as like a public health intervention of identifying the need. A school-based is when you do that, but you also bring some sort of services to the school. Those services could be a sealant school-based program, which is a more of a public health program that is evidence-based. Or it could be that if you have an FQHC that comes bring sealants, but they also bring some other services when they identify the need. Did I explain that right, Dr. Kumar?
Yes, I'll give a little bit of history. You know, school-based programs were established in 1900s in New York to actually deliver treatment services in schools. So, and then over the time, most of the schools changed to a preventive program because it became very difficult to provide treatment services. And then this is the, I like to call 19th century model. And then, of course, the virtual dental home was introduced in California. And sealants were introduced in the 80s. And all these interventions have been shown to be effective. But one big change happened during this time. So these were all school-based programs that were mainly gap-filling programs, meaning, you know, there were 50% or more without dental insurance coverage. And these programs offered free preventive and treatment services in schools. So, you know, with the coverage, now almost 90% of children have dental insurance coverage. So it changed the dynamics. So in other words, if every child has dental insurance, so all we have to do is link them to a source of care. The biggest problem was lack of a follow-up. I'm sure Tuolumne is here that can tell you, I went to Tuolumne and Erica told me, you know, I screen children every year, but one thing I don't know is what happens after the screening is done. That's when I started thinking about Okay, we have to come up with a referral management system to close the loop. So that's what we're trying to do here in California. So every child should have insurance coverage. And by all estimation, California has sufficient number of dentists and hygienists. The problem is mainly distribution, in my opinion. And we have, we are working on addressing that. And then, having a very robust referral management system, we should be able to link children not only for preventive services, but also treatment services, because most children in these underserved communities may need some treatment. So we can, link them both to preventive services and treatment services.
Great, thank you. So next question is from Jan. It's a three-part question. She's asking, has the RFA been released? Second question is, are we to shift to planning activities in fiscal year 5? And will the new RFA include present activities?
Joanna, you want to take that question?
Sure. Okay, so please expect a special funding announcement early October of 2021. Of course, we can't discuss the details until it's been approved. So that's why we are planning for early October to be able to present to you the funding announcement and all of the details. So please stay tuned to that. And we're not really shifting any activities, but just planning for the next cycle. So again, in your current work plan, school-based activities were, we had several activities and that was a focus of ours. However, we know that COVID caused some delays and we lost some time. So we really wanted to encourage everybody to take advantage of this time that we have. So we have about a year that we could start working towards, and what would that look like? And that's why Dr. Amanzadeh was so helpful, because it's we have this time to plan. These are our goals. This is what our focus will be. And what would that look like? What would that plan look like? So I think she was so instrumental in helping us just see that kind of step-by-step process. So we're still focused on the same things. We're just trying to help you move forward and take advantage of this time as planning time. And just know that in the next cycle, this will be a priority. Our evidence-based programs. I hope that's helpful, Jan.
Thank you, Joanna.
Yeah.
So next question is from Robin. It's a little bit long. So in terms of advocacy for the new public health infrastructure funds, could the Office of Oral Health please present to both County Health Executives Association of California, CHEAC, and the California Conference of Local Health Officers, CCLHO, at the state level to inform them of the statewide successes in the need for concerted funding in the local health districts for oral health funding. That way, the local advocacy has a platform to which to build on.
Great suggestion. We'll follow up on that one. Thank you.
Great, thank you. So another question comes from, so what are some differences in rural versus urban areas as far as opportunities and challenges for establishing these programs? How can they overcome them?
Dr. Amanzadeh, you want to
Can
take
you repeat the question?
Sure. So what are some differences in rural versus urban areas as far as opportunities and challenges for establishing these programs? How can they overcome them?
Yes, fantastic. Thank you. Really rural and urban areas are very different. So when we are talking about challenges in the rural areas, really a lack of providers, sometimes lack of infrastructure when it comes to kind of public health infrastructure, or partnerships depending on the county, right? Some counties have kind of a lot of CBOs engaged in the health of the communities, but have some rural counties have less of those. So a challenge in rural areas would be really kind of just knowing that about the county, and just knowing about the challenge of distance, challenge of geography, challenge of like Central Valley has different challenges of diversity. And I don't want to call diversity a challenge, I stay corrected, but the challenge of not being able to meet that diversity and the need of the population around language and around cultural sensitivity, right? So they all play into access to care. And in some of the urban areas, then the challenge becomes, how to really think about, reaching out to the kind of some inner cities areas and poverty, and expanding the programs to kind of like to the whole population if it's a bigger county. So how to overcome this is really kind of case by case basis, and kind of really thinking about the infrastructure and what's needed, and from there moving to kind of like thinking about the solutions. I would say having consortiums, regional consortiums would be helpful. I think that's something we could start focusing on a little more, as far as the kind of support that we could bring, as far as kind of some regional focuses, so that we can kind of share some promising practice at the local level. Here's what I have so far. I think I talked more about challenges than solutions.
Great, thank you, Dr. Amanzadeh. So next question is Marjorie Neer. She's asking, with the recent resurgence of coronavirus cases, this may impact our outreach efforts. Is there some guidance on this? And the second part is, does Medi-Cal allow for billing for dental services via teledentistry or in person at the schools?
I'm hoping this COVID goes away. So if COVID is around forever, then it will become like a common cold. So everybody will start accepting it like common cold. And that, common cold is a coronavirus, basically. So I hope this, all the challenges presented by COVID will go away by January 22, or at least substantially reduced. So I don't want to plan everything based on this coronavirus being here forever. Okay, so, and the second one is about billing for services in schools. Yes, there are currently dental programs operating in schools and billing Medicaid. So, and if you're talking specifically about teledentistry, we want to know more about exactly what teledentistry service means. Because if it is just talking to parents, I don't think it will be a billable service. If it is in the context of a virtual dental home, yes, it's allowable. So it depends on what exactly, there's not a whole lot, in my opinion, you can do with teledentistry. Because it's a surgical procedure, or even, you have to deliver some of these services, unlike in behavioral health.
Great, thank you, Dr. Kumar. I know we are almost at time, so I just wanted to mention that thank you, Robin Alanji. She has put in the chat box that there is a meeting today of community health workers for CalAIM, and she has provided the link. If you have not received the link, I'm more than happy to provide the link through email, so please go ahead and email that to me. And if we did not get to all of your questions, we will be sending, please again, send me an email, and we will go ahead and do a follow-up.
Yes, and I wanted to also add that in our next follow-up webinar, we will incorporate the answer to some of your questions from this webinar as well.
Great. All right. So I want to thank thank you and thank all of our presenters and audience for a very engaging session. It was a pleasure to have all of you with us. So this is going to conclude today's webinar. We will be scheduling our next webinar, which will be a deeper dive, as Dr. Amanzadeh said, in September. So please be on the lookout for an invitation. So thank you again, everyone, for joining. Please stay safe and have a wonderful day. Thank you.
Have a great day. Thanks again.
Thank you.